One. Yay, okay, it's working. Part two, I was talking about studies that I had, and I gave Dr. Joel Alcantara, who is the research director for the International Chiropractic Pediatric Association, I gave him a kind of the whole lump of all the information. I don't know about you, but one of the ways that I have to process stuff sometimes is to lay it all out in front of me and see what I have. And so I had about 79 different posture analyses that I'd done, multiple ones for 29 women, and I just wanted to find out, is there anything in here that's related? So I had to dig back into my old statistics books, look a little bit online for how to do the stats on things, and I thought while I was going through that there would be some other interesting things if I would want to see a correlation with them. As I mentioned in the last bit on Q&A, the posture analysis along with baby positioning and delivery was one of the first things I wanted to look at. I was also interested to see if there were other predictors like body mass index, or if their jobs, or if the presenting complaint, anything else like that would have a correlation with posture. Along the way, I decided, well, hey, why don't I look at how body mass index correlates with delivery type? Because there is some research that says that women who come in and they're heavy have a higher rate of intervention. And so I wanted to see if that was true for my sample size too. One of the things that I've had in the last, they say in practice when it rains it pours. You start seeing one thing and all of a sudden everybody has it. For me lately, it's been blood pressure issues. There have been two good studies done on chiropractic and blood pressure. And it's hard to generalize those studies because the techniques that the chiropractors used were called upper cervical techniques. Mainly because the whole idea behind upper cervical chiropractic is that we're adjusting the very, very top vertebra, one or two, and allowing the body to regulate itself through that. They do a lot of exercise, a lot of rehabilitation to reset the body's balance sensors, but they're very, very specific in what they do. And I was reading some of that research and I wondered, hey, my technique is a little bit different. I do a package that we do at Palmer College is kind of either called the Palmer package or the diversified package. And oh, one second, is that me? Do you hear that? Oh yeah, it is. Oh. I'll take that in a second. So I want to know if the adjustments that I do, if I can do a, kind of generalize our findings for people who do kind of the most common set of techniques in chiropractic, if we still have an impact on blood pressure. And mine is going to be more of a case series, but there is going to be a very, very large study done by Palmer College of Chiropractic and the Department of Defense. Mount Sinai Medical Center is involved. I think it's the Department of Veterans Affairs, and they're going to also be looking at a very large study on several things, one of which is the impact of chiropractic care on blood pressure. Now, with expecting moms, as I was going back through my numbers, I noticed a couple things. One was that women that I had who had high body mass indexes, the way that you figure that out is basically by taking your weight and your height, and you can plug it into a formula. It's really easy. Any kind of healthcare provider can do it and calculate that for you. Women who are over 34, which is high amount of body weight per unit of height. Women who are over 34 had 3 of my 5 C-sections. And my other 2 C-sections, one to this day, were still, there really isn't any other explanation other than the baby's head really was too big for the mom. He, after about 24 hours of labor, 4 of which he was in the canal engaged. I mean, he was crowning, he was there, but he just couldn't get through. So he had to come back out the other way. The other one, my mom had some special anatomy considerations, and so it was probably a good idea to monitor her birth in a hospital situation where they could help out if they needed to. But those other 3 had high BMIs, and they also had some either heart issues or blood pressure issues. So I thought, that's interesting, because usually chiropractic does a good job of helping to regulate blood pressure. That's been my experience, and not lower blood pressure necessarily, but regulate it. I've had some patients come in with really low blood pressure and have it regulate. I've had some patients come in with high heart rates and it's regulated. I've had some patients come in with high blood pressure and it's regulated. But for a couple of those women, I'd been adjusting them throughout their pregnancies, and they still were brought in by their OBs into the hospital because of high blood pressure considerations along with protein in their urine. For those of you who don't know, those are signals of something called pre-eclampsia, and that's a medical emergency. So that was really interesting to me, that because I also had two women who had BMIs who were over 34, they had a history of high blood pressure, and their blood pressure responded to the chiropractic adjustments. So I'm going to do a little bit more thinking about this as I write these case series up. But it seems to me that there might be a type of blood pressure that is neurologically controlled and can be impacted with the chiropractic adjustments. And if we can figure out the women who that works for and the ones that it doesn't work for, then that might be a really good clue for us as to who might be a good candidate for chiropractic helping them stay out of the hospital. Do you know what I mean? Instead of just taking everybody who has high blood pressure and saying, oh, well, this combined with the fact that you're heavy puts you at risk for a C-section, if we can show that chiropractic in some of those cases can lower their blood pressure, they might be able to deliver naturally, and we don't have to be so worried about it. Because I was talking to my OB friend, Dr. George, and right now in the obstetrics field, they're looking at a theory that there's fluid, there's a control with the capillaries, the very ends of the blood vessels, that isn't being regulated very well. And so there's fluid on the outside, there's lots of swelling, and so it was new, at least from all the research he's done. It was a new idea that there might be a difference in types of preeclampsia. So that would be really exciting. I'd like to put that case series together, think about that a little bit more, and get that published too. We're going to talk part 3 a little bit more about one of the books I recently read, the 5 Love Languages, and stay tuned for that.